Hi everyone, and thank you for joining us. And I hope you've been having a great TLG experience if you've come through TLG. We're happy to kick off Friday's webinar sessions. My name is Assaf Frances, and I'm Zen City's Director of Urban Policy. Before my role at Zen City, I was a Senior Project Manager on the Bloomberg I team for the city of Tel Aviv in Israel. And at Zen City, I'm in charge of our local government partnerships with organizations such as TLG, ICMA, ELGL, NACO, and many more, as well as in charge of our content. This includes our case studies, best practices, reports, and blogs. I also have with me today, Jay Davies, Chief of Staff at the City of Peoria. Jay has been the Chief of Staff to the City Manager of Peoria, Arizona for the past 2 years, after serving for 20 years in a variety of civilian management roles in the Peoria Police Department that culminated in the role of Deputy Director, overseeing such functions as media relations, budget and administration, communications, and neighborhood services. He's a certified public manager, holds a master's degree in public administration, and is a graduate of the Northwestern University School of Police Command. Thank you for joining us, Jay. And we also have today Kelly Corsette, Director of Communication and Public Affairs for the city of Scottsdale, also in Arizona. Kelly has been a city communicator in Arizona for more than 20 years, at one point also working with Jay, including the past 10 years as Communication and Public Affairs Director for the city of Scottsdale. Thank you, Kelly, for joining. Okay, so during today's session, we're going to be discussing the hottest new garment in our lives, which is hopefully saving our lives, masks. We know masks are here to stay, but we're also seeing what contested and heated public debate they've been causing all across the nation, pretty much all across the world. I can tell you in London, people are not wearing masks, which is interesting. On our agenda today, what challenges have masks mandates been causing? How have we overcome them if we manage to? How can we increase compliance through better communication? And we will all be sharing some examples and best practices for you to be able to use. And we also encourage you, of course, everybody else who joined us to do so as well in our Q&A section at the end. And of course, feel free to drop anything that's on your mind, be it a question, a thought, an example in the chat box, and we'll address everything at the end. Okay, so first off, for those of you who don't know Zen City, we're a platform solution helping over 150 local governments by now, big, small, and medium, better understand their residents, especially those who don't directly engage with you through the official channels. In the US, we're currently working with cities across 24 states, actually 25. We just added Virginia today. Cities including LA, Chicago, Austin, Elk Grove, Mankato, Lamont, Winthrop, so really all shapes and sizes. We enable cities to tap into the residents' needs and concerns around key city-related issues, from public safety to sanitation, parks and rec, transportation, and more recently, masks, reopening, and everything COVID-19 related. Our technology automatically extracts millions of data points from organic resident engagement channels, including social media, news media, and city hotlines. So again, both city-owned channels, but also non-city-owned channels. And then we analyze them according to volume, sentiment, sources, and other aspects, which I'll show in a second. So this is a quick snapshot of our dashboard on the coronavirus face mask and covers project, which each Zen City gets. And you can see how it allows you to sort of slice and dice the data according to different parameters. So time, topic, sentiment, official channels, unofficial channels, sources, and you can see the data over time, again, according to the distribution of sentiment and volume. You have a distribution of the volume here on a chart on the right, popular words that are rising in the discussion, and even where in your city this discussion is coming from. And this is all clickable and manageable to move through all the dashboard. And if you're, and of course, if you're interested to learn more about us, feel free to go to our website, reach out to me directly, either through my email or LinkedIn after the webinar. And also, since we're still part of TLG today, you can get a 10% off a yearly subscription to Zen City if you use promo code TLG 2020. All right, so that's about us. Masks. So here's an overview of the discourse volume across about 120 of our cities and counties. And this is during May and June. And in this period, our data detected about 10 million online interactions from all across the nations about face masks. And as you can see, interestingly, during the second half of June, there's a massive spike in the discourse, actually of 300%. And that's around when, in a lot of states, they decided to delegate mandate setting down to local governments, and public online discourse pretty much jetted up, as you can see in the graph here. But actually more interestingly, if we break it down by regions, we see that the Mountain Plains region, in which Arizona is also included, that was the big charge in discourse over that period of time. And we'll hear in a second from our speakers exactly what caused this spike. When we broke down the discourse into main arguments of residents by sector, we saw that the majority of them were actually focusing around retail stores and restaurants. As you can see, it's a pretty close tie. And most of the actual arguments were around questions of enforcement. So who's going to enforce it? Are they actually going to enforce it? And of course, discussions about issues of refusing service to people who were wearing masks, etc. And I'm sure you can all relate to this. Some of these occasions have been on the news. So these are the main arguments that residents were raising about masks during that period. And of course, on a city or a county level, we can break that down for you into more details, the for and against arguments, so that you can then fine tune your messaging and enforcement accordingly. Okay, so by looking at all this data across all the cities that we work with, we're also able to kind of see all the different communication styles and messaging across all the network. And that enables us to really identify trends of best practices, things that we see that work better in terms of their engagement and the positive engagement that they elicited from residents. So 4 tips that we can give you, and these are pretty straightforward. I'm sure, especially if you're a communication person, these totally make sense to you. But one is keep it short, right? To the point, talk in numbers. They provide really good evidence for you. Be informative, make sure your residents have all the information they need, and try and get creative and visual, because there's so much communication out there. You really need to stand out when it comes to a message that's important. So a couple of examples. So we have here a tweet from the end of June by Mayor Lori Lightfoot from Chicago. And you can see, wear your masks, people. Super short, to the point, with points between the words to kind of accentuate how practical and simple this message is. Another example from Texas, using sort of a local slang and the logo of the city and the color of the state and the city. Wear your mask, y'all, it's required. So to the point, very short, as you can see here. Numbers. So a couple of examples. The one on the right is really substantially very heavy with numbers. Obviously, not every message can have and contain all these type of numbers. But what it does, it really gives people evidence into what happens when they actually follow the rules of social distancing, mask wearing, washing their hands, to show the effect that these measures have on the actual numbers of people getting sick, lives saved, etc. This is from the state of Ohio. And again, on the left, Mayor Lori Lightfoot from Chicago shows that there's been a real decrease in the number of positive cases. And this is because people were practicing social distancing. They were practicing wearing a mask. These numbers didn't just magically drop. Attributing the action to that is critical. Informative. So we've seen all these in a variety of ways. How to wear your mask. The mask doesn't only protect you, it protects others. And you're protecting others when you're wearing it correctly. And as you can see here on the right from the city of Carlsbad in California, how different types of kind of relationship between you and another person, if you're wearing a mask or they're wearing a mask, what's the risk of spread that each of these scenarios have. And finally, creative. This is something that we know is always helpful. And we've seen a ton of these. A couple that I found interesting is this one from Memphis, comparing your face mask to the way you need to wear your underwear. I found it really amusing, and I'm sure people stopped to read it because it was unusual. It stood out from everything else, and it's obviously in bright red, so it stands out in your social feed. And if you're a cat person, I'm specifically not, the one on the right from Aurora could be helpful in getting that message across to you. And one thing to note is that obviously you can incorporate all these 4 tips into one message at all times. What's important is to keep the core message kind of running through all of these and attack it each time from a different angle, perhaps using these or other methods that you've seen to work for you, but keeping that message constant and flowing to your residents so it really sits in, right? We're trying to create a social norm. We're trying to create a new social construct. And it's really important to continue these messagings from different point of views. All right, so we're gonna move on to Jay. Jay, let me know when you want me to move on with the slides. And yeah, any questions you guys have, please let us know towards the end. Jay, on to you.
Okay, yeah, if you want to move to that first slide.
Yeah.
All right, so starting out with our challenges, at the time we were, right before you saw the big spike in the graph that Assaf showed us, there was some, of course, state level dynamics and metrics were consistently moving in the wrong direction. But more locally, we had some concerning local zip code data. We had one zip in particular that was getting a lot of attention due to high numbers. We weren't sure if it was due to a testing site reporting or concentration of senior facilities, but that was cause for concern. And then secondly, a lack of local authority and control. At this point in Arizona, the governor had really preempted the cities from enacting any measures that were more restrictive than what the state had in place. And while the divide in public sentiment was certainly alive and well, our graph for discourse around masks really mirrored what Assaf showed you, and that was, it was there, but it was pretty low and steady in the first half of June, and then of course hit a spike there mid to late June. So those were our challenges at the time. In terms of successes, early in the pandemic, our city manager began assembling cross-functional teams to begin addressing many of these unprecedented challenges that he knew we were about to face. Those internal teams engaged with key internal or external stakeholders. The first was a COVID action team, which I've been honored to lead, largely tasked with problem solving, developing our recovery plan, monitoring data and conditions, and really problem solving both the internal and external challenges that we were facing as a municipality and as an employer. The second was an outreach team. This was a team of everyone from police to park rangers, code enforcement, the parks folks, to work on education and enforcement around the various state and local orders. And then the third team was business support. They were going to assist our local businesses with applying for federal dollars, helping with signage, using city channels to promote the whole shop local theme where appropriate, providing information as folks were pivoting on who's open for what as a public service. And ultimately, each of these three teams would become invaluable in their respective lanes as the mask issue ramped up. Next slide, Assaf.
Yeah.
So as it becomes clear that Arizona's key COVID metrics are steadily trending upward, on Wednesday, the 17th of June, Governor Ducey issues a Stay Healthy, Return Smarter, Return Stronger order, which, among other things, allowed local authorities to enact face covering ordinances to slow the spread of the coronavirus. As you might imagine, within seconds of that announcement, phones are ringing off the hook, and we begin here in Peoria a pretty intensive internal review. The governor's message really was that the best interventions were those based on local needs, and that resonated with our mayor, who was very eager to support that approach. So she began reaching out to the executive team, and we took a very fast and as deep as we could look at what are neighboring jurisdictions doing. For consistency and lack of confusion across jurisdictional lines, it was important for us to know kind of what was happening. We're situated in the West Valley, kind of the opposite side of the valley from Kelly. So we wanted to know what was happening in our area so that we could be consistent. We're also beginning to hear that the county Board of Supervisors was considering drafting something. We wondered, would that be all encompassing? Would that preempt the cities? On the converse, if they repealed it soon after putting it in place, would that leave us with nothing? So at that point, kind of a strike while the iron was hot thought crossed some of our minds. And then the next piece was Zen City data. This was really, COVID and the masks in particular was really a test case for us with respect to Zen City. We've been holding our Zen City data pretty close to the vest up until now at the executive level, not really engaging our electeds openly in kind of what we were seeing, providing it more anecdotally than really full access to the Zen City dashboard, or even that was the source. But clearly with the decision ahead of the mayor on what to do with the mask order, it seemed this was the time, and she found it incredibly helpful. We were, at this point, we didn't have any users in the mayor's office, so we were feeding them as we could grab graphs and data and sentiment and actual messages, sharing that with the mayor's assistant. Because with any elected official, a sense of where the public stands on an issue is one important part of a decision-making process. It's not the only part, fortunately, but it is a big part. So in this case, it was quite evident that positive and negative sentiment were really neck and neck. But this data split was really not something to toss out. It was actually quite telling. And that is that, either way, you're going to upset a small segment of vocal constituents, but the overwhelming neutral sentiment really showed a path forward to follow the state's guidance, to follow the science, and to provide a pretty consistent regional approach. Next slide, Assaf. So our mayor did just that and struck while the iron was hot. She issued a proclamation on the 19th, 2 days after the mayor opened the door for that, requiring face coverings in public where social distancing was not feasible. That, of course, brings about the question of enforcement, and that remains, a hot topic today. While the proclamation, ours anyway, cited an ordinance that does have penalties, and the icon here might suggest a heavy-handed approach, our proclamation requires an educational contact on the first offense. And consistent with the ongoing guidance from the state throughout the virus regulations, our outreach team has emphasized and employed an educational approach to gain voluntary compliance, whether it's closures, capacities, social distancing requirements, and we applied that with masks as well. Even though there is a penalty that could be paid, we were heavily emphasizing education. Because the reality is that the true enforcement of this mask ordinance falls to the businesses who have responsibilities under Arizona's state order and of course face even greater pressure from social media or direct contact with upset patrons than any enforcement officer could put upon them. Our business outreach team that I mentioned previously, they have been providing support to help our local businesses manage their responsibilities, provide signage, help them with messaging. One of the clear messages that we got back from our dialogue with that group is that they really would like the opportunity to talk with patrons before patrons leave and post on Yelp or other social media platforms that they had a bad experience around mask enforcement, things of that nature. Please talk to the manager, give them a chance on site to make it right. So we've tried to help mirror that message as well. So at this point, we decided we had a responsibility to initially provide masks to the community. It had been 2 days since the governor announced that we could do this. Not a lot of cities had acted, although we certainly weren't the first to pull the trigger, and that was not by accident. We definitely did not want to be the first ones out of the chute on that. But knowing that it would take a few days for folks to kind of absorb this, it was over the weekend by now. How do they get these masks? Where do they get them? We saw it as our responsibility for the initial first few days to provide masks to the public. So we began distributing off of our shelves some things we had in supply, which were surgical masks, until we could pivot and get a supply out there of cloth masks. If the idea is to provide masks for the public to wear on an ongoing basis, you want those to be the reusable and more durable cloth masks and face coverings. The public sentiment you'll see on the insight there on that slide, following the mask order, things begin to taper off. Certainly there was a lot of discourse there around those few days, but as with everything else, that tended to subside as the days move forward, and we're still seeing things kind of down at that level. So next slide, Assaf. Mm-hmm. So in terms of moving forward, where are we going from here? Arizona, for those of you in Arizona, this, we're kind of in a place with the data that we're wondering if maybe we've hit a plateau. Certainly the numbers currently are trending downwards, which is good. Question is, will it hold? So we're monitoring that. Our COVID action team is monitoring that and poised to make decisions and recommendations. If so, we'll turn our attention to a series of proclamations that we've issued along the way, including our local state of emergency, which we've kept in place to give us flexibility. Beyond that, and what those mean for the public, we continue to monitor the health of our workforce, their access to timely testing, and for our employees with school-age kids, resources to help with that daunting challenge. We've pushed out a number, basically a toolkit for employees that we're probably going to put out on our public website as well. In Peoria, the discourse around school opening, I'm sure is a lot like what it is in every other community. So we're trying to provide a lot of resources there. We have really from almost the first day that we stood these teams up, we've had active internal and external web pages that provide real-time updates and helpful information, links, things of that nature. And with that, we'll continue to do that as we move through these stages. So with that, I will turn it over.
Thank you. Thanks, Jay. I've written down a couple of questions, but we'll save them to the end. But thank you very much. Very insightful. Kelly, on to you.
Hello. Thanks very much, Jay and Assaf. Scottsdale's mask story, similar to Jay's, of course, in the same state under the same governor's executive orders. But I think it probably sounds a lot like a lot of people's around the country and even around the world, potentially. Ours is a tale of uncertainty that was followed by outrage. And then now what we feel and hope continues to be acceptance. We, in the middle of it, added a very serious and somewhat self-inflicted wound in that big plateau, that big spike in discourse in the Western states. That was probably due to something that occurred in Scottsdale that I'll talk about in a couple of minutes. But first, let's talk a little bit about the uncertainty around these masks. So on this next slide, if you could move it along there, Assaf, Scottsdale we were literally on the front lines of Arizona's COVID crisis from the very beginning. And at the time, we really didn't even know it. But this innocuous looking and little red tweet that we sent back on March 5 was our entry into this world. So this was case number 2 in Arizona that a Scottsdale fire crew transported. And then that crew was put into isolation protocol once it was learned that the individual was COVID positive. So we rapidly stood up an incident management team and started trying to understand this virus and what its impacts were going to be on our community and also on our workforce. And there was just a lot of uncertainty, and I think a lot of folks involved shared similar situations. One of everybody's early concerns, if you remember, was that there would be a run on personal protective equipment, that our first responders and our frontline healthcare workers were not going to be able to get the supplies that they needed to work with patients who were COVID positive or exhibiting symptoms. So on the next slide, we'll see that's why people like the US Surgeon General were saying things like this: stop buying masks, people. It was the right thing to say at that time. And this tweet actually predates ours by about a week. But we've all heard that saying that you never get a second chance to make a first impression. And the impact of that uncertainty on the topic of masks in the very beginning is still being felt. And a lot of people developed a belief at that time that masks were ineffective and should not be used against coronavirus. I did not even see this tweet when it was first sent. Like I said, it predates our first COVID-related tweet by about a week. I didn't see this tweet from the Surgeon General until about a week ago, because someone was popping it into comments on our posts when our mayor extended our local mask order. And so we're still responding to the uncertainty and the misinformation. Well, at the time it wasn't misinformation, but now it's not the current thinking, but that stuff's out there and we're still responding to it. That's the environment we're in. We've got to accept it. And I'm sure that's not specific to Scottsdale. Let's pull up the next slide if we can, please, Assaf. Another aggravating factor on this topic of uncertainty is time. The speed at which communication is moving makes it very difficult to stay on top of things, much less get in front of them. And it's always difficult in a crisis when you're working on your facts, trying to make sure they're well thought out, they're legally defensible. In the meantime, the world is just flying at light speed. This quote is actually from 1710. Falsehood flies and the truth comes limping after it. I don't even think Twitter was around in 1710. So it was a problem even back then, and it's more so now. And that speed of information, the rapidity at which everything moves just contributes to the uncertainty. It makes things very difficult. So how do we manage this issue? Next slide, please. Mm-hmm. So cities in Arizona, as Jay mentioned, were prohibited by the governor's executive order from issuing local restrictions. But that changed in mid-June when Governor Ducey reconsidered and said, I now am giving cities, he didn't put a statewide order into effect, but he did allow cities to do so. So similar to the experience in a lot of cities in Arizona and what Jay had mentioned, as soon as that came out, it was, okay, Scottsdale, what are you doing? And it, like with any legal order, was going to take a little while to put together. So rather than wait until we had everything figured out to start talking about it, we took an incremental approach. So first, we told folks we were thinking about doing it. And this is the first message that we sent on that topic. Hey, we're looking into it. And then next, we told them we were going to do it. Okay, we've looked into it. We're going to do it. It's coming. And then we told them that we did it. And that's the next slide. So earlier in the pandemic, there were similar situations in where other cities in Arizona were ordering restaurants to close. And during that period, Scottsdale has a lot of restaurants. We were really getting hammered by folks. What are you going to do? Why aren't you closing restaurants? It was really tough. And frankly, all we could say is that we were leaning back on public health at that time. I think based on that experience, we took this incremental approach to the mask messaging. We're thinking about it. We're going to do it. We did it. And that, I think, eased a lot of the pressure on us. It didn't make some folks less upset, but at least it kept folks in know in terms of what we were thinking about doing, what we were going to do, and ultimately what we ended up doing. So that's just a couple of insights into the uncertainty surrounding all this. After we issued it, of course, people got a little upset. So let's go into the outrage part of this. Shortly after our local mask order went into effect, one of our city council members organized a protest outside City Hall, an anti-mask protest, which attracted a couple of hundred people and lots of media coverage. So that certainly made our task a little bit more difficult, but just another bump in an already bumpy road. But then he said this. I can't explain why this council member used these words, but with people streaming it live and every news outlet in the Valley, the backlash was immediate and really unlike anything we had ever experienced. If you can go to the next slide, please, Assaf. Mm-hmm. When he said, "I can't breathe," and took his mask off, America was still reeling from the murder of George Floyd. And to take social injustice and racial unrest and combine it with the belief that mask orders were government oppression, it just whipped it into a frenzy that really slammed us really, really hard. This particular video was viewed 5.5 million times, just to give you a sense, and this was not the only one out there. So if you've ever wondered what going viral looks like, take a look at this. This is the next slide. For the first time ever, we routed calls to the mayor and city council directly to voicemail. We have great staff who answer those calls, but it was too much. We were getting thousands and thousands of calls. Our staff were being abused. It was really, really rough. If you look at this volume of discourse from our Zen City Insights, when this council member said these words, it pushed us on that one day toward 450,000 interactions. So I think we can take a little bit of the blame for that Mountain States spike. Yep. Yeah, it was a very, very difficult time for a lot of our staff. The interesting thing is, if we go to the next slide, we of course we spent a lot of our time talking about what was going to happen to this council member, what could be done, what the public was demanding, all kinds of things. And so we spent a lot of our time just talking specifically about that. As this Zen City Insight told us, we had 736,000 interactions on this topic in a 4-day period. It was, as I mentioned, it was intense, it was difficult, but we did get through it. And the councilman apologized. The furor seemed to die down largely. He happens to be running for re-election, so the voters will have their say. And then we could turn our attention once again back to talking about the fact that masks are required, and here's why you should wear them, which takes us into our current phase of acceptance. And to me, this insight really illustrates our overall progression as a community. The top bar is where we were in June, where we had pretty big chunks of polarized expression on this topic, people at one end or the other. And as a lot of us know in these situations, you're unlikely to move most of those people. You're really trying to talk to the people in the middle who may be uncertain or undecided. Well, what we were able to do through some things that I'll talk about next is grow that middle section, which is the second bar on that page. And this was a really kind of an aha moment for me that told me, oh, wow, I think what we're doing is working. And I think the overall public acceptance on this topic is growing, because that middle section of neutrality is, hey, if we can get people into that acceptance zone, they may not have to be happy about it, but if we can get people there, that's a good place. So we were really pleased to see that. And next slide, please. Despite all the ups and downs, I think one of the biggest things that we have done is been consistent throughout as we speak about our masks and demonstrating our commitment as a municipal organization to operating safely and helping our business community operate safely, showing people how we walk the walk. We put together this Q&A on our website. When we issue an executive order from our mayor, it's long and it's legalese and it's complex. So we immediately knew, all right, how do we help people actually understand what the rules are? So we put together this Q&A on our website, which has been one of our more popular pages. We point people back to it consistently. And then the next slide is one piece that I definitely wanted to include, which were scientific references supporting the efficacy of face coverings, because I'm sure you all are all getting it as well, but we get pinged constantly, even from some of our own staff about, hey, you know, I heard these masks don't actually stop the virus. So there's a lot of continuing education that goes on, and this is a key piece of our Q&A webpage to help folks show there is scientific backing for this. It's a little difficult because not a lot of studies have been done specific to coronavirus. But these are helpful and we point people back to them routinely. Next slide, please. The other thing that we've been doing is really just trying to demonstrate to people that we as a community are walking the walk. And as Assaf showed some of those great examples from around the country, we're trying to do it in a creative way. We have a 26-foot tall steel rabbit sculpture, which is probably not something every community has. But our public art folks created a giant yellow mask for the sculpture, whose name is One-Eyed Jack. And she made a matching mask for Mayor Lane. And so we took advantage of that opportunity to get some photos of the mayor and One-Eyed Jack and share that on social. And then next slide, please. I think a lot of us have tried to tap the love of animals to illustrate this. So this is Chase. He's our police crisis response canine. And he was good enough to model some mask wearing techniques, some do's and don'ts. And this was a very popular post as well. And then next slide, please. We have put together what we call our Healthy Scottsdale campaign. Our tagline, it started internally, is a healthy Scottsdale starts with you. And that is the tag that appears on all of our internal messaging related to this. But in the past few weeks, we have turned this to be a public-facing campaign. And we've been doing a lot of posts about it. And just yesterday, we had a team get out into our business community in Old Town Scottsdale and deliver about 50 poster packs with these mask signs, with other signs, with hand washing signs, because we were noticing a lot of businesses were kind of slapping up homemade things. So we're providing our businesses and our organizations with these packs of information. They can download social posts from our website. And it really is, I think, helping get a consistent message out there into the community. So that's a quick snapshot of what our journey has been so far. And I hope it's useful to some of you, and I look forward to continuing this discussion. Thanks.
Thank you, Kelly. I definitely prefer Chase over that cat. So he would have made me wear a mask. Okay, thank you very much, guys. And now we have some time for a Q&A. Anything you guys want to share? I've written down some questions, but I want to make sure people in the audience get your questions ahead or anything that needs clarification. So feel free to open your mic. This is an open discussion, and I'll wait a couple of seconds. Anybody want to share something that they've done, what worked for them, what didn't work for them? And oops, I actually did put some questions to lead us here. So if anything sounds relevant, your biggest challenges, how did you solve them? Or if you fail to, that's also really insightful to share, right? Our failures, not just our successes. How did you respond to anti-mask comments and agenda? These keep coming up on our social feed. So that definitely comes in relevant. I see one question here from Julia. Do your staff engage with negative responses on social media? Exactly what we were just discussing, to address their negative statements or potential misinformation on the city's socials.
I'll hop in on that one. We really do it on a case-by-case basis, honestly. Some people are just there trolling us. We have some folks who are running a very bizarre pick and choose kind of health agenda, and they have their right to do that. But sometimes we do confront it directly. For example, when that Surgeon General tweet started popping into the replies to some of our recent posts, we said, hey, that's from February. Here's the current thinking on this. And in fact, if you go to the Surgeon General's page, he does nothing but talk about the importance of wearing masks. So it is important where you can to correct misinformation. We're fortunate enough where we have someone who's able to spend just about all of her time on our social media accounts. I know that having been a one-person shop or a two-person shop for a long time, that's a luxury not everybody has. So of course you've got to use your time wisely. I'll say the other thing that we decided to do is I don't know how many of you are on Nextdoor. Most of you probably are. Nextdoor is a huge platform in Scottsdale. I think there's about 80,000 registered users in our community. So when we post on Nextdoor, it gets out there. But we were finding the posts on masks and some of these topics really just led to a lot of unfriendly conversation. And so what we decided to do is we would leave those discussions open for 24 hours, but then we'd close them. Mm-hmm. And we just found that closing them after a set period of time is a rule that we could defend. And it also reduced the number of folks who were contacting us to say, hey, you need to shut this conversation down because it's getting out of control. So it's really is a case-by-case thing for us.
Jay, anything from you to add on this?
Yeah, we had a similar approach, and we kind of fit that description that Kelly offered of a much smaller shop. So we can't monitor all of these things, and it's definitely a case-by-case. But we, as I mentioned early on, we stood up a public-facing website, very similar to the one Kelly describes, with a lot of Q&A, a lot of links to the science, to the CDC, Department of Health. So our answers when we would see things like that cropping up would be to steer people back toward, rather than engaging in kind of a tit for tat, we would direct them back to our website and to the facts.
Has anybody of you or in the audience have deleted posts or comments of people, saying anti-mask comments?
I'll say what we do is we have legal policies that all of our social point back to, and it tells folks that we will moderate comments that are off topic, vulgar, personal attacks. And so in some cases, yeah, we'll have someone hop into completely unrelated posts and ping us with some of this information, and that's off topic. So we moderate those, and we have a system that anytime we do that, we document it.
Mm-hmm. Okay, so we have a question here for Jay. Who is enforcing the mask mandate? Is it enforced upon the individual, the business, the property owner? How many citations issued? Any other things that you can relate on this? Any other aspects of health orders enforced? I was also going to ask this. Did it ever come to a citation?
Yeah, great question. I can tell you unequivocally, we have issued this many citations. Our approach has been education. Our local mask ordinance actually requires the first contact with an enforcement officer to be an educational contact. So in other words, you get a warning before you get your speeding ticket, so to speak. And that's been consistent with really the governor's desire, I think, for how all of these things are handled is that, you look for voluntary compliance I know even in cities throughout the pandemic that have issued citations and taken formal enforcement in action, a lot of that stuff is going to take so long and really be so pushed out simply because of the nature of courts under social distancing requirements, that it really won't have much of an impact to give somebody a citation now that they may never have to answer to at all. The other thing is, again, with my background in the police department, I'm glad that we took that approach, because I knew, we have 180,000 people who live in our city, more that visit it, and, a couple hundred police officers. If you do the math, we don't have the resources to deploy police officers to mask violations. It's just not practical from any standpoint. So our approach took all of those factors into consideration, and we've really focused on supporting the businesses, coming out publicly and saying we will support businesses, and we will dispatch officers if they're having difficulty handling their responsibilities as a business owner with respect to what the state orders require of them. So we're providing a supporting role, but the bottom line is we've issued and probably won't issue citations except in extreme cases. I will tell you real quickly, about a week ago, we had a gym that was operating outside of the governor's order. We did deploy police officers to talk with them. It was an educational contact, one that was successful in that the gym did return and voluntarily comply after that visit.
Mm-hmm. Okay. Before we get to the question that was sent, I have a follow-up question on this. Obviously, throughout the country with the protests and very sensitive issue of police brutality or even action that we're still seeing, this made that challenge of enforcement even greater. And again, protests, people were wearing masks, some of them, not all of them, people were close by, and then that again started a whole discussion of, are they actually effective? You're not really enforcing it. If we can protest, why do we have to social distance, and everything kind of relating back to mask wearing? Was it something that you had to deal with, Jay, Kelly, or anybody else? And if so, how?
I don't think we really had to. It was, I think, something people were keeping their eye on. We had a very large, very peaceful, well-organized march in Scottsdale that occurred about a week, I think, after the George Floyd murder. And most people were wearing masks. It really, that side of it has not become an issue for us, thankfully. I'm 100% with Jay. I think overall the approach of education and voluntary compliance has been one that most cities have taken, and I think that's appears to be effective. I think the big thing that we went through is there was a period of time where masks were recommended, but they weren't required. And during that period, I remember going to grocery stores and things, and I was wearing one, and my eyeballs told me about 25% of people were following the recommendation. But frankly, after they were required, I now see it's above 90. And the other thing that is that the governor's executive order and our local order, Peoria's is probably the same, says if you have a medical condition or a health reason where you can't wear a mask, you don't have to wear one, and you don't have to show proof. You don't have to have a piece of paper that says I have asthma or some sort of disease that makes it hard to breathe. But I don't think there's a ton of people who are trying to get away with anything under that. I think what we've seen is once they were required, people have accepted it. And the numbers, I saw a question about, or maybe it's here about sort of metrics. Overall, Arizona and the Valley for sure, we're looking at the COVID numbers in Arizona, because we had a huge spike after things reopened. And now we're seeing those get back trending in the right direction. And so I think the message that the governor's been putting out, that the cities have been amplifying is that things are working, masks are a good idea, let's keep it up.
Yeah. I think also the fact that masks are visual are, for the good or for the bad of this, people see you wearing a mask, so that creates a social construct. And if people don't see you wearing a mask, that creates the opposite effect. So The more we see people, we're more likely to wear a mask ourselves. Okay, question from the audience. So is there targeted messaging to communities based on positive rate, demographics, such as primary language and internal accessibility?
I know Jay mentioned a couple of zip codes that got their attention early on. The state health department in Arizona resisted releasing zip code level data for a long time. Eventually they did. And I know that Scottsdale had some pretty high zip codes. And so that did create a lot of public concern initially, but the public health director was very good and very quick to say that zip code data is not something that public health people look at. Because there's no way of saying, if people who happen to live in a certain area, where do those people spend all their time? You know, I work in Scottsdale, but I live just about in Peoria, which is 35 miles away. So if my disease gets reported on one side of the valley, does it reflect accurately where I was exposed or where I got it? So we really leaned hard on that county health message. The county health director has done a great job sending out short 1.5 minute videos, getting at these key topics. And I remember that was one that we shared a lot. We shared it with our own staff and we shared it with our community to say, hey, the zip code data is out there, but that's not what public health people look at as they're trying to track down this disease.
Mm-hmm. Yeah, and largely I would agree with Kelly, simply because the messaging is the same. Our electeds and our own internal teams, we recognize that there are some conditions that affect lower socioeconomic areas, zip codes differently, and there's more, there's a greater impact in those, and there's a lot of probably anecdotal data when you look at zip code data that would support that. Things like concentrations of frontline workers, more dense neighborhoods, more people living together, all of these things, maybe access to healthcare. So those are factors that might impact the case rate. There's certainly an argument to be made there, but the bottom line is the messaging to those areas is the same. Wear a mask, social distance, wash your hands, you know, avoid people not in your family. So in terms of, you know, is there targeted messaging? I would say while the impact might be disparate to some degree, the messaging is pretty much the same.
Mm-hmm. Thank you. So actually, Jay, I want to refer to a point you mentioned in the beginning, that you, at the onset of this, you started supplying people with masks for free, right? For about how long?
We did it for about a week.
Okay. And was it targeting a specific population, a specific socioeconomic level, or was it free for all, whoever wanted to come can grab?
You know, that's a great question, because our intent was just to get masks out. And we have a couple of facilities. We have a community center in Old Town, in kind of one of the older, lower socioeconomic areas of town. We have a community center or a rec center that's kind of midtown, and then the library. And those are the places that we put them out, simply because those are the public facilities that we have that were open and available for people to go get them. What we realized pretty quickly was the north part of our city doesn't really have something like that. And so we probably were shortchanging folks up there that wanted access to them. So we added a location. We have a police substation up there, and we made them available up there. So we didn't intentionally target any areas, but we accidentally did by the availability of facilities.
Mm-hmm. Okay, interesting. One thing that came up from both your arguments is, one, on a state level, this kind of cooperation between counties, between different cities within the state. As you mentioned, people move around, they don't stick in their own city. Different messaging, sometimes even different regulations or different emphasis in the regulation and messaging. How you both handle that. And Kelly, more to you, the issue with this, with the council member, that was obviously very difficult for the city. What can you tell us a bit about sort of the behind the scenes? It's always interesting between the council and sort of the professional cohort of people like you in the city who kind of lead the messaging, and all of a sudden somebody comes and overturns everything. Our residents don't always distinguish between our council members and our professional cohort. So that's interesting for me to understand.
Well, we certainly did some educating. From a communication standpoint, it's always tricky for the official city statement to sort of target one individual council member. In this case, our mayor and each other individual council member wanted to issue a statement that made it clear that the words of this particular council member did not reflect their belief or that of the city. But it was very difficult. I think the overall effect, I found it really interesting because it really spiked hard. It created a lot of furor. We saw what that spike looked like. But after he apologized, and I think that piece really tapered off, and it put us back in the position of continuing to educate folks about the mask requirement itself. And we haven't had to spend a lot of time on that particular topic. I will say that a lot of education amongst our own team and our community was required in the days after, because folks were demanding that he be removed from office, that he be censured. And we had to teach people about the rules that are in place and the limitations of our own city charter, which is our constitution, so to speak, for the way that we operate, which really does not allow for those things in Scottsdale. So a lot of education has occurred and frankly is occurring as this topic comes up. But the overall impact on the city's core coronavirus messaging does not seem to have been negatively impacted, I don't think. So.
Okay, so thank you. And I want to be conscious of everyone's time. So if Jay and Kelly, any kind of last words, messages of what you're planning to do next, what you're hopeful about, and also what you're kind of seeing as your next challenge, whether it's masks or anything communication related to coronavirus. Jay?
Yeah, so, and I kind of mentioned at the end of my presentation, what we're looking at now internally is our workforce. We're in a very good situation. We've begun monitoring cases per, basically the equivalent of cases per 100,000. Our workforce is in a much better place than both the nation and the state of Arizona. So we feel that's a helpful kind of guardrail to keep up so that we know kind of where we're headed. That said, our next decision will be, as these numbers continue to, if they do continue to taper downwards, when do we move into a phase 2? We've adopted our own reopening plan that mimics the one the state is following, as well as the national government, that phased plan. So we're looking at that real closely and looking at what our next steps will be.
Kelly? Kelly?
Well, similarly, we have focused a great deal on our workforce and continue to provide them information to understand the situation and how we're operating. We've got some additional information about emergency leave and some things like that we'll be providing to them. I think one of the smartest things we did early on was we created a daily brief. Our internal communication had been a weekly e-newsletter before that, but early on we saw the need to really beat the drum regularly. So we've put together a daily brief. We have a great team member who puts that together. So every day we're sending out current information to our staff and reinforcing messaging, and I think that's helped a great deal. The thing that we're really looking at between now and the end of the year is as Jay mentioned, we hope that the numbers continue to taper and we can move back toward looking at how we're going to return to reopening some things that have been closed. That Healthy Scottsdale messaging program is really eyed to be in place for, I think, honestly, the next couple of years. The council and the manager were good enough to set aside some CARES Act funding so that we have some specific money for that program. And we've got signs going on our solid waste vehicles, and we're going to be purchasing advertising at our major retail shopping centers as those start to hopefully reopen to a larger degree. And so we're really going to push that Healthy Scottsdale message from now, certainly through the end of the year, because one of the things that we're hoping is that our tourism and events season will return in 2021. coronavirus hit at a really tough time for the Valley, because that's the height of our tourism season. Spring training baseball is like a Super Bowl that occurs in the Valley every year, and it was canceled last year. So we're really hoping that can return next year. I don't know if that'll be practical or not, but we know that the more that we can talk about and reinforce healthy messaging, it'll put us in a better place should things be back in a position where they can return. So we're really focused on that between now and probably the next 12 months for sure.
Okay, thank you. Well, good luck with everything that you guys are doing, and thank you for the great work that you've been sharing with us today. We'll obviously continue to follow the discourse on the Zencity data. And thanks to everybody else who joined us today. This presentation has been recorded, and you can get all the slides. And if you're interested to hear more about Zencity, obviously you can message us through our website or directly through me. Thank you again, Kelly and Jay, and have a great day, everyone.
Thanks, everyone.
Bye-bye.